So the big question is, will the CDC give that okay to resume administering the J&J vaccine? Let's go to infectious disease specialist and ABC News contributor, Dr. Todd Ellerin, for more on that. Dr. Ellerin, good morning. What do you think? Will the CDC greenlight the J&J vaccine again, and if so, when?
Good morning, Diane. I do think the CDC will give the okay for the J&J vaccine because it's very safe and very effective. But like Steve said, they'll likely put a warning attached to it. And the big question is, are they going to limit the age eligibility like many countries in Europe have done with that different vaccine, AstraZeneca's, though that has a similar platform? And I do think that's possible. I also want to say that, when you think about the science and the emotional part, yes, it's 1 in a million, but this is daughters, it's sisters, nieces. And when you're that person, the question is, we know that J&J vaccine is very safe, but could it be even safer if a certain population receives a different vaccine? That's what the CDC is going to grapple with today.
Now, what happens if the panel doesn't approve this? How much of a setback would that be in the effort to get the country vaccinated as quickly as possible?
Right. So I think that's very unlikely, but the J&J is a very important vaccine, not just for the rest of the world, but also for the United States. Because remember, there are a lot of people who live in rural areas. There are people that really can't make it to these appointments. They have essential jobs. They're probably afraid that if they leave, they may lose their job. So we really need that single-dose vaccine and one that can be refrigerated. I think the J&J vaccine is very important. Can we vaccinate the U.S. with the Pfizer and Moderna vaccines? We can, but it would take much longer.
Now, if the panel does approve the vaccine again, should Americans feel comfortable getting it? How do you reassure the public after all of this?
Really, it comes down to numbers, and the science basically says we're talking about something that may be less than 1 in a million people so far. Remember, the likelihood of dying in a car crash over a year period is much, much, much more likely than that. So I want people to understand that overall, irrespective of what the CDC decides, the J&J vaccine is very safe and very effective.
Now, we're already starting to see the pace of vaccination slow down a bit across the country. We're at just over 50% of the adult population. So what do you think's behind that recent slowdown? Is that to be expected, or is that something to worry about?
So, Diane, remember, we're talking about an average. Before, we were about at 3.4 million vaccines a day, and now we're a little over 3 million per day. I don't want to draw too much conclusion from that decrease, but I think one of the things you're getting at is how much is vaccine hesitancy contributing to this decrease. And I do think if it's not happening now, ultimately we will see vaccine hesitancy play a major role. And one thing I want to emphasize is that vaccine hesitancy is complicated. It's not just people saying, I don't want to get vaccinated. It's a heterogeneous group of different types of behaviors, and some people still want to get the vaccine, but they want more time to pass. So I think we have to look at that closely. The most important thing I can recommend to anyone who may be vaccine hesitant is please talk to your provider and try to work it out with them and then come to draw your own conclusions.
Now, one thing I have heard a lot is if I still have to be masked, what's the point? And one of the reasons that people who are vaccinated still have to be masked in a lot of areas is because it hasn't been clear up until this point whether the vaccine prevents transmission. So what's the latest on that?
Oh, this is very good news, okay? Multiple studies from multiple parts of the world, including the United States CDC, did a study looking at about 4,000 healthcare workers and frontline providers. And what they showed is that after 2 doses of vaccine, 2 weeks after the second dose, a 90% reduction in asymptomatic infection. That's infection in the back of the nose. And what that tells us, if you don't have infection in your nose, you're not going to be transmitting it to other people. We've seen this in Israel. We've seen it in other countries. There's no question these vaccines reduce transmission efficiently and effectively, and it's not just symptomatic disease. So that's going to really bode well for the entire world.
Okay, so what does that mean for masks then? Because we know we're all sick of wearing them. So if you are fully vaccinated, are we soon going to hear from the CDC you don't have to wear a mask anymore?
I think, as you know, the CDC has been really thoughtful when it comes to this. By the way, they already have in their literature the fact that if you're walking alone or you're not around other people outside or you're with your own family, you do not have to be masked. But I do think that they're going to go further and basically say that most people don't have to mask when they're outside. But we probably still want to keep it in our pocket. Why? Because if you're in a crowded area where you can't distance, especially if you're unvaccinated, maybe you're with someone who may be high risk across the table from you in a short range, I still think there will be a place for masking outside, but most situations, I think we're going to be able to rip the mask off.
So inside, if it's just family, a bunch of low-risk people, if you're vaccinated, you don't have to wear a mask. And outside, in most situations, you won't have to wear a mask. But we're still not going to be going to concerts or anything like that.
Not yet, but, you know, hopefully at some point.
All right, Dr. Ellerin, great to talk to you. Thank you.
Take care, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.